I've been in practice as a plastic surgeon. I've been a plastic surgeon for 30 years now. I've been in private practice for 27 years in Plano, Texas. We opened our surgery center, the Plastic and Cosmetic Surgery Center of Texas, in January of 2000. It is a freestanding building with confidentiality and privacy and convenient in and out. We do a lot of gynecomastia surgery in our practice. It's become the most common procedure we do. I was taught, just like virtually every other surgeon, to do the 3 o'clock to 9 o'clock incision around the areola and cut out the glandular tissue. And about 11 years ago, I came up with the thought, well, there must be a better way to do this. And this is how I came up with the technique where we don't have a scar on the front of the chest, but it is all delivered through an incision, small incision under the arm. What is very popular about this procedure that we've come up with is that besides having no scar on the chest, another thing that most people don't consider is, since there's no break in the skin on the chest, you are unlikely to get a scar contracture, distorting the areola and pulling it down towards the muscle. We get many patients from out of state and long distance. We've had patients from Trinidad, Guam, Africa, that have come in for this procedure. To my knowledge, there are only 2 other practices that offer this same procedure, one in Manhattan and one on the West Coast, and we all develop this procedure independently of each other. I consider myself a specialist in gynecomastia surgery. We did 184 cases last calendar year. Most plastic surgeons, if they're honest, will do 4 or 5 a year. I enjoy doing the procedure because men hate this. They do not like man boobs, and they get ridiculed by their friends. They feel self-conscious going to the pool or the beach or playing in the pool with their kids. And so these are about the most gratified patients that we deal with. Oftentimes men realize they're developing so-called man boobs, or moobs as we call it, which is gynecomastia. And a very common cause of that is perfectly legal supplements that are pro-hormones or testosterone boosters that you can get at GNC. Surprisingly, it only takes a month to 2 months to start to see the bad side effect there. The only way you can really prevent that is to take an estrogen blocker, such as Arimidex, and that's commonly what people do who are taking anabolic steroids for competitive bodybuilding and so forth. There really isn't any type of food that either encourages gynecomastia or results in its reversal. We see gynecomastia in 4 groups of people. First of all, men and women are born with breast buds. Now, women get breasts because their ovaries are pumping out estrogen. Well, what happens in the first group of men at puberty is testosterone levels surge to sky-high levels, and some of that gets converted into estrogen, specifically estradiol, and stimulates the breast bud. The majority of those cases are reverse on their own, but if it persists more than a year and a half, typically it will require surgery because the glandular tissue has been activated and enlarged. Second group we see this in are men in their 20s, 30s, and 40s. They might take pro-hormones or anabolic steroids, and so the mechanism is the same as in the first group. The third group is men in their middle age. They don't have high hormone levels, but they have more body fat, and it makes that conversion easier. And then the fourth group is miscellaneous. It may be side effect of a prescription drug, perhaps, or we may not even find a reason. How can you tell whether you just have weight gain, which is called pseudogynecomastia, meaning fake gynecomastia, or true gynecomastia? Well, true gynecomastia has nothing to do with how much you weigh. You can't lose weight and have it go away. And the way you can tell is actually to just grab the tissue, and you will find that it is very firm, as opposed to your love handles or stomach, in which the fat is very soft. Completely different. That's also the reason why when surgeons try to correct true gynecomastia with simply doing liposuction, it is never successful, because you do have to cut away excise that glandular tissue. As far as the surgery itself, this typically takes 45 minutes to an hour. It's done under general anesthesia. This is a safe surgery. It's very superficial. It's not as if we are operating inside your chest or your abdomen and your internal organs. This is at the skin level, essentially. We also, during the procedure, inject a large amount of local anesthetic called a tumescent technique throughout the tissues, which not only vasoconstricts the artery so you don't have blood loss, it also reduces the amount of general anesthetic gas that you need. So when you wake up at the end of the procedure, your chances of nausea are just about zero. People ask whether this can be done under local anesthesia or twilight sleep. I wouldn't advise it. This is a very sensitive area, the chest, and to do it properly and to really get all of the tissue out that's necessary, you need to be asleep for this. When the surgery is completed, somebody has to drive our patient home, and they should stay with them overnight as well, just as good medical practice. Quite a few people are on testosterone supplements or therapy. We have found that those are the patients more likely to have a postoperative bleed. And so we ask that if anyone is on testosterone therapy or supplements, that they be off of those for at least 3 weeks before surgery, and that includes testosterone boosters or pro-hormones. It's also very important to be off of any blood thinners such as aspirin, fish oil, high dose vitamin E. We fully expect a patient to be back at a desk job in 3 days' time, and that includes driving themselves to work. When we do this procedure, the last thing I do is inject a large volume of a long-acting local anesthetic throughout the operative site called Marcaine, so that when our patients wake up, they're pain-free. It also stays pretty much numb until the next morning, and then it's easily controlled with just Motrin or Tylenol with codeine. We certainly would expect by 2 days after surgery to be just on Motrin or regular Tylenol. About the only thing that can go wrong after the surgery is to get a postoperative bleed. And so we ask that you give us 10 good days after surgery of no lifting overhead, lifting out, or heavy lifting, or any kind of exercising and so forth. The good news is, after we get through the 10-day mark, it would be very unusual to have any kind of postoperative bleeding. And as a matter of fact, by the 3-week mark, we stop the compressive garment and remove all restrictions. You can do bench press, cardio, any kind of weightlifting you wish after 3 weeks' time. If you have gynecomastia and are bothered by it and would like to consider surgery, please contact us at Plastic and Cosmetic Surgery Center of Texas in Plano, Texas. We look forward to meeting you.